to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I am thrilled to have Dr. Alex Hill with me today for this episode of Ask the Patient Advocate podcast. In the current age of healthcare, it is so important to have an advocate to help navigate for you and your loved ones. And part of advocating is having the proper resources to support your diagnosis and management. Our episode today is focused on pelvic health and patient advocacy. Dr. Alex Hill and I share the same mission to help people navigate their healthcare challenges. Dr. Alex Hill is a pelvic health and oncology physical therapist. Her mission is to help people confidently manage their pelvic health and cancer-related conditions so they can get back to living their joyous lives. And we'll talk more about it in just a few minutes. Hi, Dr. Hill. How are you? Thanks for joining me today.
Hello. Thank you so much. I am doing wonderful. I'm really excited to be on your podcast.
Awesome. Glad to hear. Well, please begin by sharing some insights into your background and experience with pelvic health and oncology physical therapy.
Yeah, absolutely. So I'm a physical therapist and I practice currently in Jacksonville, Florida. I've been a physical therapist for 10 years now, and I'm in the outpatient setting, meaning that patients will come to a clinic for their physical therapy appointments. And as you said, I specialize in pelvic health and oncology. A lot of people have never heard of these specializations within physical therapy, so I always love explaining to people what they entail because a lot of people then realize, like, oh, I could benefit from this, or my mom could benefit, or my sister. And so with pelvic health, that involves really anything in the pelvic region. So that could be bladder issues, bowel, pelvic pain, issues during and after pregnancy, sexual health concerns. So there's a lot of different things that we can work on with pelvic health. And then with oncology, I'll work with people before, during, and after their cancer diagnosis to help with preparing for their treatments and managing any side effects that they might be dealing with after treatment, like lymphedema, weakness, neuropathy, decreased range of motion, or scar tissue. So a lot of different things that we can help with in the cancer setting too.
That is amazing. And I know being a mother myself, 2 kids, I've had quite many conversations with different women, and we do have the conversation about, once we have kids, your body kind of changes, and you definitely, many women often experience some easy, let's say, leakage of urine and things like that.
Yes.
Yes. And so, it's funny because I was actually having a conversation not too long ago, a few weeks ago, because this mom was telling me that her child wanted to go to like a trampoline park. And she went with the child, and then she realized, wow, I really can't jump on the trampoline.
Oh, no.
It's not working for me. So, you don't think about these things until it actually happens. And you're like, oh, wow, I
Right.
didn't know that was going to happen.
Right.
So I can imagine that you could potentially help in these situations.
Absolutely. Things to get people back to doing, again, the things that they love to do and the things that bring them joy, like playing with their kids or, feeling like a kid and jumping on a trampoline, but without the leakage.
Yeah, no, that's awesome. That's wonderful. Last podcast, we actually had Dr. Lucas, who is a endometriosis specialist.
Mm.
Do you ever have clients that come to you for pelvic health related to like endometriosis or treatment after endometriosis?
Yeah, absolutely. A lot of people who come in with endometriosis can benefit from pelvic health physical therapy, not necessarily that we can obviously
Sure,
address the adhesions themselves, but there's a
sure.
lot of other symptoms that can be manifested from endometriosis that physical therapy can help with.
That's awesome. That's awesome. So, could you elaborate on how your specialized courses and coaching programs contribute to improving people's lives? I know it's like a loaded question, but could you just share some like instances or, like prior experiences that would kind of give an example? so our listeners can understand it a little bit more, even if you had like maybe one example.
Yeah, absolutely. So, I have basically two types of courses. I have one set of courses that are for clinicians, and
Okay.
then the other set of kind of courses and webinars. These are going to more patient focused, if you will, or for people who are actually having the symptoms. And so, the one that I have currently for people who are having symptoms is for breast cancer survivors who are
Mhm.
dealing with intimacy concerns. So
Gotcha.
unfortunately, a lot of times after breast cancer treatment, people will experience different types of sexual dysfunction, whether that be discomfort or pain. They're not able to participate in sexual play like they used to because of their symptoms. Maybe they
Sure.
have neuropathy in their hands from chemotherapy, or they're having pain in their chest because of radiation. And so this course basically goes through what types of treatments might contribute to sexual dysfunction and then what can you actually do about it. And so for me it's really important, with regardless of the type of course that I'm providing or who it's for, that people leave it feeling empowered and having actionable things that they can do. So I had recently one person who had taken the webinar course that I just talked about, and she said that it really helped to kickstart her relationship with her husband again. And it helped to not give her permission, but she just felt not as alone and not as ashamed about wanting to return to sexual activity with being a cancer survivor. Because a lot of times, unfortunately, people are told, or they feel like, oh, I beat cancer, like why am I worried about my sex life, or I shouldn't even be worried about this, when really it's something that you should totally be enjoying now. Like, you beat cancer, you should be enjoying all parts of your life. And so she said that it really just helped her start her journey and take those initial steps to work with her partner, to work with a sex therapist, to find those key people on her medical team to help her work on her sexual health. So that was really really exciting to hear.
That's awesome. And imagine many people don't know that this specialization, is out there. And I think a lot of times it's easy to like look at like the physical changes or things that we'll expect, but we don't realize that like the emotional aspect is tied to that. When there's a physical change, you're also going to have an emotional change, and it's important to address that equally, if not more. So that's
Yes,
important.
absolutely, absolutely. We work with, and I kind of joke with my patients sometimes, it's physical therapy. It's a lot of times it is the physical part and the brain part. They have to be working together, regardless if you're working on pain or if you're afraid to run because you're having leakage, or just the trauma and everything that you go through with a cancer diagnosis. It's you have to have those two things really working well together.
Yeah. So what made you get into this specific like specialization within PT?
That's, I think, the number one question that I get asked from people because it is so unique.
Understandably.
And we do with pelvic health, we do internal work as
Okay.
well, internal exams and
Uh-huh.
treatment. So so I first got introduced to this when I was in PT school. I was at a clinical rotation, and I wanted to know what they did behind the doors as pelvic therapists.
Uh-huh.
And so I shadowed for a day, and I thought it was incredible, the impact that we could have as physical therapists on somebody's emotional and physical well-being in just a single visit, by validating what they were going through and putting your hands on them, and really going through what their symptoms are, why they're having them, and getting them started on exercises or lifestyle changes to start improving their symptoms. Seeing people that had been dealing with leakage or pain for even decades and been told, oh, it's normal part of being a mom, it's normal as you get older, these kind of silly, outdated thoughts that are unfortunately still being told. And um, it came down to a musculoskeletal issue or changing their behavior in some way that was so helpful. So, for me, it just, I again just fell in love with it immediately. Um, and then the physical therapist that I shadowed that did pelvic health also specialized in oncology. So they were always together when I shadowed, and then that's pretty much all that I've practiced for the last 10 years.
That's amazing. That's truly amazing. As a private patient advocate, I deal with a variety of different disorders and conditions with my clients, but one of the ones that I mainly focus on are cancers and oftentimes like rare cancers.
Mhm.
And I love learning about different resources and, offering unique and resources that maybe they didn't know existed and things like that. With you having many of your clients, being having that had the diagnosis of cancer, do you think that some of your clients could have benefited from working with a private patient advocate, like either, you know, during their diagnosis or after?
Yeah, I do. I've had, several jobs over the years, and it's being in large hospital systems especially, it can be very easy for some people to fall through the cracks, not intentionally, but there's just such a large volume of people going through treatment and trying to navigate the system that unfortunately some people just, like I said, kind of get lost and fall through the cracks, and they're not getting the care that they need or the appointments that they need, or I work with a lot of people who English isn't their first language, and I'm spending extra time with them to make sure that they understand, with the interpreter there about what's going on. But having somebody be there with them that's dedicated to them and their care, and they're not, just another person in this large team of people coming through, I feel like would have been really helpful for a lot of people over the years that I've worked with, just to help again navigate the system, because it's very complex and complicated to go through healthcare nowadays. It shouldn't be.
Agreed.
But I think having somebody, like I said, dedicated to them, to their care, that they know that they can count on, I think would be invaluable for a lot of people.
Yes, I couldn't agree more with that, and I'm excited that now that more people are becoming more aware. There's more like education on what a private patient advocate is, how it
Mhm.
differs from like a patient advocate that's offered at the hospital or by the
Right.
healthcare system, and there's still many times where people are not quite sure what that means. But I'm happy that the first couple of years I started doing this. Nobody actually knew what a patient advocacy was. And it's funny because myself, I was working in a big healthcare system for almost 10 years before I decided to start doing patient advocacy. And
Mm.
I kept thinking for like a couple years prior to that, like, oh, I really want to do this job. One day I'm just going to, stop working clinically and do a transition. I'm going to do this job where I just like help people like independently and like just work with them on different things and just be able to give them as much time. But it's funny because it wasn't until I started looking into this, I'm like, wait a second, this is actually a real profession. I just
Right.
didn't know it
Like, I
existed.
can do this.
Yes, and it's amazing how I, being in healthcare, didn't even know this existed. So
Yeah.
there's still a huge learning curve for sure.
Well, it's amazing work that you do. So thank you for you and your team. It's again,
Thank you.
it's needed, I think.
Thank you. Thank you. So what aspect of your work do you find most fulfilling?
For me, it's that, like, light bulb moment when I'm working with somebody and I'm
Okay.
explaining their anatomy or their condition, and, like, everything makes sense about, like, why they've been having these, what they felt like were random or weird or inevitable symptoms that they were having, and, like, just that, again, that light bulb of understanding it, and then, "Oh, this is what I've been dealing with. This is the name to the condition that I've been dealing with, and here's a game plan of how we're going to address it." That's my absolute favorite part.
That's awesome. No, that's I can relate to that. I think when things kind of start going together, like the puzzle piece
Yep.
connects. It's like, yes.
Yes,
Um,
like, the last piece finally got in, and, like, ah, it's beautiful.
yes, and I know at least for me, like sometimes it's easy to find that puzzle last piece, and sometimes it takes a little longer. So
Yes.
every
Yep.
case is different, right?
Yep,
Um,
absolutely.
so what type of clients like do you work with as far as like do you accept insurance? Do you do private pay? Is it all in person? Is it virtual? Like what kind of, tell us a little bit about that.
Yeah, so I currently still work full time in a hospital system
Okay.
in Jacksonville, and then my side business, Pelvic PT, that's more of the educational consulting side.
Okay.
So at my full time job right now, we do take insurance. I'm at UF Health Jacksonville, And what's really great is we're what's called a safety net hospital. So we work with everybody and anybody in the city, which is really amazing. The mission of the hospital and the rehab department really resounded with me to make sure that everybody is able to get the best care and have access to care.
Amazing.
And so my caseload is split, kind of ebbs and flows, but in an ideal day, kind of 50-50 between pelvic health and then oncology. Like I said, we take insurance, a lot of different insurances, and we still have one-on-one appointments, which is also great. Unfortunately, a lot of rehab clinics are having to move to seeing multiple patients at one time,
Mhm.
but we're still one-on-one. We have, for especially pelvic health and some of the oncology conditions, private treatment rooms. So it's a really great system to be working at.
Very interesting. That's great. Now, for your educational consulting business, is that all in person or do you also do virtual for that?
So those courses are actually all on demand virtual right now.
Awesome.
Yeah, I wanted to make sure that they were accessible for anybody around the world that was experiencing symptoms. And then same thing for clinicians is, and I'm sure you've experienced this too, a lot of the continuing education courses, the costs are going up. You have
Yeah,
to travel to the site in person. You have to pay for the travel. You have to pay for the hotel. You have to pay for food. You have to take PTO to be able to travel and go to the course. So I
sure.
wanted to make it accessible. And to do that, I've gone the route initially right now of having them all on demand for clinicians. I have been getting some requests to do in person courses. So I'm hoping to start to do that next year for some more kind of hands-on lab type of courses as well.
That's wonderful. That's great. That's great. So, is there anything else that you wanted to mention that maybe I didn't ask?
I don't think so. I think you asked really great questions. I think the biggest thing, especially with from a rehab perspective, is just for people, whether they're dealing with their own symptoms or a family member, or if there's clinicians listening, it's to you don't have to wait until things are dire to get a referral. The
That's
earlier,
a
the
great
better,
point.
right?
That-
I mean,
Yes.
this goes for during pregnancy. Like, why wait until after you deliver to start working
True.
on body mechanics and your pelvic health and your diet and how if you already have kids, like how are you also taking care of them while you're getting ready for another new one.
Yeah, it's so important.
With
I wish I would have gotten that
Yeah.
information when I was pregnant.
Exactly. With cancer, it's this what's called prospective surveillance model of where we should be getting people into rehab, pretty much after diagnosis before they start treatment so we can get baseline measurements. We know what their balance is, we know what their range of motion is, their strength is before they even start treatment. So we can monitor that throughout treatment and beyond so that if something does start to go awry, we're able to address it sooner. So I think that's the number one thing with rehab is just getting people in sooner is the biggest thing.
It's a great point. It really is, and I think that's so applicable. And it's definitely overlooked. I know from working in the hospital myself that it's not
Right.
often. So yes, I think that is a huge point to highlight. So where can our viewers find you? Do you have like a social media handle that you can share?
Yeah, all of my social media is Onco Pelvic PT, so my two specialties.
Nice, I love it.
Yeah, so I have it on Instagram, TikTok, well, if TikTok's still a thing soon. Um, Facebook. I also have a blog and a website with products that I recommend and different suggestions, tips that has all my courses on it as well. And then I also do YouTube again just to increase accessibility for people to get the kind of evidence-based content that they need and that they can trust. It's just not another influencer that they're seeing on YouTube or some of these other social media channels.
That's amazing. That's wonderful. Well, thank you everyone for joining us, and thank you, Dr. Alex Hill, for allowing us to meet you. Please reach out to Dr. Hill or myself for any further questions and enjoy the rest of your day. Thanks,
Thank
everyone.
you so much.
If you have a question for Ask the Patient Advocate, email advocate at pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.